Hi.
Hi.
I'm Heather. I'm an Angelina College nursing student. Are you Chastity?
I am. Nice to meet you. I'm about to start a short group session here with some of our patients with antisocial personality disorder. You familiar with that?
Yes, we actually just went over it in class.
Okay. Well, you want to kind of tell me what y'all went over or what you remember?
Yeah, sure. Okay. It is a personality disorder of unknown cause. The current theory is it has both genetic and environmental factors, abuse being the biggest one. To be diagnosed with ASD, a person has to have a conduct disorder during childhood. Behavioral-wise, they're funny, charming, great at flattery and manipulation.
Okay.
They tend to constantly be in trouble with the law. They really don't care about their personal safety or the safety of others.
Right.
They abuse, lie, steal, fight with no guilt or remorse.
Okay, that's about right. So very good. There isn't a whole lot we can do for them treatment-wise, but what has shown to be effective is cognitive behavioral therapy. And with cognitive behavioral therapy, we do what we call reframing. We take these negative thoughts or these bad thoughts and try to think of them another way so that before they make a bad action, they'll think about it and do something else instead. And that has seemed to work with him. And a lot of positive and negative reinforcement.
Okay.
So that's been working for us.
Are there any specific drugs to treat ASD?
Actually, no, there's no drugs that we use. We mainly use our cognitive behavioral therapy, but it doesn't mean that they're not on some type of medication, because a lot of times these people have concurrent conditions like ADHD or maybe depression, so they are taking drugs, and the doctors are very, very careful with how they prescribe them drugs, because a lot of them are also substance abusers.
Oh.
Okay, it's about time. Are you ready?
I'm a little nervous.
Well, don't worry. If anyone hits you, I'll be there to defend you. Hello, everyone.
Well,
I'm Chastity, and this is Heather from Angelina College. Today, we're going to have a session over our communication skills, and we're going to cover social skills. And since this is our first meeting, I want to set some ground rules. First, no interrupting during the group when each other are talking. Pay attention when everyone's talking. If you do have a question or a comment you'd like to make, please raise your hand. Everyone will get the same amount of time to talk. And please, no rude comments. Anyone have any questions about that? Any rules you'd like to add?
no, ma'am.
All right then. Okay, so what we're going to do is introduce ourselves. Once again, I'm Chastity, and I'm the nurse here, and this is Heather, the student from Angelina College. She's going to be sitting in with us today, if that's okay with everyone. Everyone okay with that?
Whatever.
Okay, well, thank you. Okay, would you like to introduce yourself and tell us why you're here?
Yeah, I'm Tony. I'm here because of a court order.
Okay, and what preceded the court order?
Well, I took some money from my brother, but he really wouldn't even notice it. He has so much.
Okay, that seems really frustrating for you. Have you ever been to court for anything else?
Yeah, I stole some equipment from my brother's properties, but he dropped all the charges. He just needs to change his lock so we don't have this problem in the future.
Okay, let's hear from you now.
I'm Kay, and I'm here because of my boss.
Okay, because of your boss, could you explain?
Well, I was arguing with a customer, and he stuck his fat nose in where nobody wanted it, and so I broke it.
Okay, and let's hear from you.
Well, my name is Hannah, and I'm not here because of a court order. My family begged me to be here.
Okay, could you tell me more about that?
They said that I was manipulating people and that I didn't care about the things that I do and stuff like that, but I think it was because of what happened to my cousin.
And what happened to your cousin?
Well, she was crying about missing her husband once again. It happened over a year ago, so I just got sick of hearing it, and I told her that if she missed him so badly, she should join him. So she took my advice.
And what was your advice?
That she should kill herself.
You're terrible.
Hey.
Who the hell are
You
you?
don't even know the
Hey,
situation.
I'm just
Not
saying.
interrupt.
Okay,
Let's
all
not
right.
interrupt. Remember
All right.
the rules.
Okay.
Okay. All right. So
decision, so there's really nothing I can do about that. Am I right?
Yeah.
Okay, well now that we've introduced ourselves, let's talk about the purpose of this group. This is a closed group which will focus on our communication skills and techniques. A closed group means that we will not be adding any new people to the group. So the people that are here are the people that you're going to be seeing every week. We're going to meet every Monday, Wednesday, and Friday from 10 to 11. This therapy is going to be in combination with your cognitive behavioral therapy that you'll be receiving. And cognitive behavioral therapy is, we use what we call reframing. The thoughts that you're having that are negative and cause you to take negative action, we will try to revisit that thought so that instead of taking the negative action, you'll think it through and do something more positive with that. Does anyone have any questions about any of that?
How often do we come here? How long do we have to be here?
It's going to be Monday, Wednesday, and Friday, and it's going to be 10 to 11. Did anyone else have any questions? Okay, well then we'll start back. Okay, did you want to continue your story about your cousin?
I mean, I don't think that I said anything nobody else was thinking, so.
Well, what happened before you talked to your cousin?
Just having a bad day. Boyfriend broke up with me.
Wonder.
Hey, why don't you keep your mouth shut like
I
you're
say
supposed to
keys a
be?
little bit. it'll be
Okay,
all right.
that's good. Remember the rules here. Let's remember. It's okay. It's okay. Sometimes things like this happen, but you're okay. Okay, let's do some deep breathing. Okay, deep breathe in through your nose, out through your mouth. Okay, now nursing school is much harder than what we just had, so it'll be okay. But you did get to see how antisocial personality works. You think you want to be a psych nurse?
No.